How to monitor body changes for early reproductive cancer detection. Keeping an eye on your body for early signs of reproductive cancers is an important step in maintaining your health. It starts with understanding what to look for and knowing when to seek medical advice. Regular self-examinations can help you catch changes early. For testicular cancer, men should perform monthly testicular self-exams starting in adolescence. Gently feel each testicle for lumps, swelling, or any changes in size or texture. Be alert for symptoms like a painless lump, swelling, or a feeling of heaviness in the scrotum. If you notice anything unusual, consult a healthcare provider promptly. For cervical cancer, routine screening is key. Women should begin Pap smear tests at age 21 and follow the recommended schedule, usually every 3 years. These tests help detect abnormal cervical cells before they develop into cancer. Be aware of symptoms such as unusual vaginal bleeding, pelvic pain, or abnormal discharge, although early cervical cancer often shows no symptoms. The human papillomavirus vaccine is also a powerful preventive tool against high-risk HPV strains that cause most cervical cancers. Women over 30 or those with abnormal Pap results should follow up with HPV testing as advised by their healthcare provider. Other reproductive cancers like ovarian or uterine cancer requiring attention to different signs. Watch for unexplained pelvic or abdominal pain, bloating, changes in urinary or bowel habits, and abnormal vaginal bleeding, especially after menopause. Routine pelvic exams by your doctor can help identify abnormalities early. For ovarian cancer, screening methods such as transvaginal ultrasound and blood tests measuring Ca1 to 5 are mainly used for women at high risk, like those with a family history or genetic predisposition. These tests are not generally recommended for women at average risk because they have limited ability to reduce mortality. General early detection tips include staying aware of your body's normal patterns and reporting any persistent or unusual changes to your healthcare provider without delay. Participating in recommended screening programs based on your age, health history, and risk factors is essential. Remember, early detection often involves a combination of self-awareness, routine medical exams, and screening tests rather than relying on a single method. Always seek personalized advice from your healthcare professional to develop a monitoring plan suited to your individual needs. In summary, staying vigilant about body changes, keeping up with regular screenings like Pap smears and pelvic exams, and being attentive to warning signs are your best tools for catching reproductive cancers early. These steps, guided by medical guidelines, can make a significant difference in early diagnosis and effective treatment. Always consult with healthcare professionals to tailor your monitoring efforts and ensure your health remains a priority.